It's KKLT again, Kevin Carrara Leukemia Trust. We're continuing to talk about emotional well-being, and especially for people struggling with cancer and living with cancer, with their families and friends. Last week, we talked about pain management, and today we are continuing that with talking about how to alleviate stress and anxiety. But before we do that, let me remind people about KKLT, who we are, what we do. So Kevin Carrara Leukemia Trust is a charity that was formed after Kevin Carrara, a 24-year-old, had leukemia, could not get a bone marrow match, simply because there are very few people, or there are very few Black people who registered to become stem cell donors. So we thought it was a good idea to educate people, create awareness, so that we can increase those numbers and we can get more Black people signing up to become potential stem cell donors and save lives. And that's what we do. However, within the work that we do recognize that so many people go through a lot of emotional stress, and especially when they are undergoing cancer treatment. Their families also suffer a lot. And we thought that it was a good idea to give people these emotional skills so that they can be able to manage their illness as well as their family and friends, to equip them how to support their loved ones during this tough journey. So, and we have been doing this for the last number of weeks. And today, as I said, we are covering emotional support and well-being. But today, the topic we are covering is alleviation of stress and anxiety. So let me start by just talking about what is alleviation, because alleviation is really about making things less severe. It's also to lighten or to lessen the stress or any issue or problem they might have, making it easier to be endurable. And why do we say that? It's because when you have such a serious illness or you've been diagnosed with cancer, it is obviously true and real that you will undergo a lot of stress. It's quite a stressful situation. It's quite a heavy diagnosis that will make you definitely feel down. And of course, alleviation of that stress is very, very important so that you can be able to manage your well-being, so that you can be able to manage what is ahead of you. On the other hand, stress is very common. We all experience stress, but the most important thing is how much is your stress? And stress is defined as a state of being in of mental stress or emotional strain, which is normally caused by adverse circumstances. And of course, a diagnosis of cancer or living with cancer, that you could classify that as an adverse circumstance. It's a difficult time for everyone. It can cause a lot of stress in many ways than one. And from that, and from stress, comes anxiety. So anxiety is the mind and body's reaction to stress. So once the body has experienced extreme stress, what really shows up is the anxiety. Anxiety is what we see outside. It's the behaviors, is the reactions that kind of express itself after you undergo a lot of stress. So I just thought of explaining that, even though I know for those people who are undergoing treatment and cancer management, they are aware of this, but at least it is good to understand the basics before we can do anything else. So in our first session, I think we talked about cancer diagnosis and what it entails and what people experience and what people go through. So of course, a cancer diagnosis constitutes crisis, which comes with emotional crisis and other crises. What does that mean? Despite the person who's been diagnosed going through the emotional crisis, there is also the crisis within the family. What are we going to do now? what is this has overcome us? What is it what are we going to do? So there are so many crises that comes with the diagnosis. But the main thing that we want to deal with is the emotional crisis that the patient goes through and the family members, that what happens within themselves, the questions that they ask, the emotions they undergo through, and it can really be very, very stressful. Emotions like fear, like anger, and also confusion. So emotions like fear, when we go through fear, when you have a diagnosis, as we all know, when people hear cancer, we all understand what the word cancer comes with. It comes with a lot of things. And people are bound to have to be fearful of what's going to happen in the future. What am I going to do? Am I going to die? Am I going to get better? What does this cancer mean to me? What will I do with my family? How will my family cope? What if I die? What will my family? So all these things come with fear. Sometimes people also go through anger, and anger is about why me? Why now? I can't cope with this now. People start even blaming God for everything. So there is a lot of confusion in terms of the emotions that somebody who's been diagnosed with cancer goes through. And the same thing also happens with the family members. And these are the times that people need to share and talk about what they're experiencing. And sometimes people don't do that. They do not share, they stay with their emotions, and those emotions cause a lot of stress. Again, remember when you undergo fear, you release a lot of chemicals in your body. Your body is quite full of adrenaline because you're always worried about what's going to happen. And then during the treatment, people go under chemotherapy, they go through radiotherapy, others go through surgery, and all this causes fatigue. Now, if you add fatigue of the treatment and the fatigue caused by the physical drain caused by the emotions you're undergoing, then things becomes more worse. And sometimes the treatment can even take longer because you are treating one thing, but another thing is causing or aggravating the treatment process. Because when you're undergoing the chemotherapy and radiotherapy and surgery and all that and taking all the medication, and then on top of that, you are experiencing emotions that are also creating havoc within yourself, that also now aggravates your condition, your cancer condition, and it makes things more worse. And sometimes the treatment takes longer, and it takes even longer to heal. So the reason we want to talk about taking care of our emotional health is so that we can be able to be in that place where the treatment goes smoothly and you actually make the healing quicker, and you don't go under a lot of stress and emotions, chaos. So the other one is, the other one I wanted to talk about is worry. Of course, as I said, once you're diagnosed with cancer, once you're undergoing treatment, one of the key things is worry. And of course, any kind of cancer causes worry. And why worry? Worry is you just worry about so many things. And I don't know whether anybody here is with us who is aware of the kind of stuff that goes through our mind in terms of worrying. And as I said earlier, I think I mentioned earlier, you go through the worry of what's going to happen to me, and what is become of me. Will I ever get better again? Will I survive this? People start thinking about death. People start thinking about their families, their children. And can you imagine, I was just talking to a friend of mine who was diagnosed with cancer, and she had a little girl. And I think most of her worry was, what's going to happen to my baby? What if I die before she sees me, before she gets to know me? And that can be like that person, the key worrying about that child. And then there are so many other things that to worry about. If you're the breadwinner of the family, if you are the key person in the family, if whatever it is, people worry about so many things. People worry, then again, the other big worry is about the future. What's going to happen? Will I survive this? Will the treatment work? I mean, all those worry creates a lot of stress. And sometimes I put bereavement mode there because sometimes when people are diagnosed with cancer, it is sometimes inevitable that some cancers are not treatable, or they end up, with you losing, people losing their lives. And sometimes people go through the bereavement process. And what does that mean? There is this lady called Kubler-Ross who wrote about the kind of stages people go through when they are diagnosed with a terminal illness. And as I said earlier, people start by the shock, the denial mode, then the anger, the fear, the confusion. Usually people also develop depression. There is also before depression, there is the bargaining mode where people kind of bargain. They bargain with God. If you could let me do this, if you could give me a chance, why did you let this happen? So a lot of things happens there. And then people go through depression. From depression, then people get to that place of acceptance. So it's quite a process, and it's the same thing that people go through when they lose their loved ones. So it's the same also process people go when they get diagnosed with the terminal illness. So that bereavement mode is really very aware. It's also very good to be very much aware. Where are you in terms of when you're diagnosed? Where would you be in that process? Are you worrying about the future and death? And in that case, depression can really creep in very quickly. All those emotions can be happening within you. All those fear, all those anger and everything. And sometimes those phases do not just happen in sequence. It can be one thing can start before the other. Depression can start the bargaining, and it can happen at any time. So it's really very, very important to be aware of these phases and to be aware of this process, so that awareness really helps you to know where you are, so that you can be able to deal with what is happening. So knowing with all that information and with that knowledge, what can we do to minimize vulnerability and loss of control? I think we talked last time and last week about knowledge is power. Having that knowledge, knowing your condition very well, asking questions, knowing what does my diagnosis entail? What is it am I struggling with? Then from there, it's about what is the treatment? What should I expect? What is expected of me? So that really kind of gives you that power to be able to know what is it that you're dealing with, so that you can be able to face that journey with confidence and with that knowledge. And no wonder they say knowledge is power. Then from there, it is also good to get very well organized, have lists of, various kind of lists that is helpful to you personally, because we are all different. Have a diary of appointments when you're going to see your doctor. Always prepare your questions beforehand. Follow your treatment regime properly. At this point, it's also good to ask for help, look for support, find, where you can get help and stuff like that. Remember, what you're doing, you're minimizing that emotional instability that you have. Then, in terms of your self-efficacy, is about planning for your meals beforehand, knowing what your do's and your don'ts, what hurts, what works, what doesn't work. All those kind of helps you to have that control. And especially as a patient, having that control within yourself, you know what is happening, you know what is expected, you know what to expect. However, in terms of, I always tell people, every human being and all of us, we like and we love having control. We like knowing what's going to happen tomorrow. We like having that power of being able to do things, to control outcomes. We want things to happen our own way. We want to have the best outcomes. So if you have a disease like this or any illness, really, you want to get better. You want to know that you're going to get better. And because of that, we really suffer that idea of not accepting where we are at any particular moment. So it is always very, and because we are human beings and prone to that, then we suffer more, because when things are not going our way, when things are not working to the way we have planned, then it causes us more stress. So it's really being aware of what are you in control of and what you are not in control of. What you are in control of, by all means, do that. Do what you are in control of. If it is about getting to know your disease, as we have discussed, managing your appointments, asking questions, knowing what you should eat and what you shouldn't eat, what is painful, what is helpful, what is not unhelpful. But anything else that you don't have any control, just do not worry about it. Because when you worry about that thing that you're not in control of, then it causes you more stress. And remember, we don't want stress. We want to minimize stress so that your body can heal slowly. Your body can heal, can take the process of healing. Because what really makes any illness more difficult to heal is because of what's happening in our head. It is the thoughts we are thinking. It's the emotions and the stress we are not managing very well. So in this case, what we are talking about here is we are aiming at making sure we are managing those stress, those emotions to the best of our ability, so that we can give our body that time to heal. If it's you're undergoing chemotherapy, if you're undergoing whatever treatment you're going, you need to give that body of yours that time for the medication to work and to heal. Otherwise, when you add more stress, when you add more emotional distress, then you are aggravating your body, and it takes longer. It takes longer to heal. So I hope what I've talked so far is making some sense. So what can we do so that we can be able to be in that place where we can allow healing to take place without adding more?
Can you hear Veronica, or is it just me?
Can you hear? Are we together? Boy, did you say something?
Maybe it's just me.
You can't hear.
I can hear.
Okay. Maybe it's where you are. So going back to what I was talking about, is what can we do to make sure that we are giving our body that time to heal without adding more stress into our body? As I said, cancer can cause your mood to fluctuate because of so many issues that as I have said, and also can very easily cause depression. So the good thing is you talk to your doctors and they can do an assessment. If they feel your depression is really clinical in terms of, because there are different types of depression. There is serious depression, there is mild depression, and there is just the normal mood changes. So if you're in that probably very deep, severe depression, then that can be helped by taking some medication or some depressive medication. But if you are not in that place of severe depression, then we can do other things like dietary intake, exercises, and some other things that we're gonna see at the bottom what what you could do to alleviate that stress and those emotions. We also know about food is really very, very important for cancer patients, not only for management of mood and emotions, but also in the management of aiding healing. And I know from within our community, I know that we are aware when you have cancer, it's good to eat some types of food. And it's always good to get the best advice wherever you can, so that you don't start eating things that maybe they're not working for you. Because remember, everybody is an individual and we have different types of cancers as well. So it's always very good to be able to get the right advice for the kind of food that you need to take. But definitely there are foods we need to avoid. And that especially junk food, that is a no-go area. So usually people with cancer are advised to eat more plant-based food, more vegetables, lean meat. So, and it's really looking at what you're eating. It's also very, very good, because remember, we are not just healing we are healing not only the mind, we are also healing the body and everything else. So it's very good to be aware of what you're eating. And your dietary intake is very, very important during this time of treatment. It's good to involve your family members in terms of what is happening. Talk about what you're feeling, your emotions. Let them know where you are. Let them know how you're feeling. Talk to someone, as I said, asking for help. Discuss the best things that makes you feel better. Let everybody be on the kind of food you're eating so that they can help you to prepare those foods, including your friends, whether you're alone or with family members or friends. Let people know the kind of food that you take, because we know people with cancer take special foods. You don't expect them to eat just any food. So that would be very, very helpful. But the next important thing is staying in the present moment. This needs practice. This needs involving your thoughts. This is where when your mind goes into the far future and start worrying about the far future, or worrying about things that you don't need to worry about right now, you just bring your mind into the present moment. And in the present moment, you just deal with what needs to be dealt with in the present moment. So this idea of thinking about what's going to happen next week or in the future or in the far future, always you can acknowledge that you're thinking like that, but the idea here is always bring your mind back to the present, right now, right here. What do you need to do? What do you need to focus on? Do not focus on things that are necessary, that are going to get your mind engaged in things that you don't need or require, increasing your stress when you don't need to. So what you need to do is to be able to be very mindful of your thoughts, what you're thinking on a daily basis, what is worrying you, what you are feeling as well, being very much aware of the kind of emotions that you're experiencing in every moment. So it's good to be always in touch with yourself. How am I feeling right now? What kind of emotions am I experiencing? And where did that emotion come from? If it came from a thought, why am I thinking like that? So it's really kind of doing those exercises on a daily basis, being very mindful of what you're thinking and being mindful of how those thoughts are making you feel, so that you can be able to focus your mind to bring your mind here and now in the present moment, so that you can be able to manage what needs to be managed right now without worrying about that needs to be managed tomorrow. If something needs to be managed tomorrow, leave it for tomorrow. Tomorrow when it comes, you'll deal with it. But for now, what needs to be focused on? What is the priority? And those thoughts, if they're taking you far back in the future, or if they're taking you very far back in the past, you don't need to be in those two places. You always need to be focusing on here and right now in the present moment. That needs exercise, that needs awareness, and that needs practice practice, practice. And it will really, really help you to be able to calm your mind and to calm your body as well, so that your body can be in that place, as I said, where healing is taking place without struggling with other things. Because I want us to discuss about what needs to be done, let's talk about the techniques that you can use to alleviate stress. One of the best things is about sleep. And why sleep? Because sleep is a funny one, because when we are stressed, we don't sleep. And when we don't sleep, then we are stressed. And it makes us more stressful. So what we need to be aware is about sleep. Make sure you're getting enough good sleep. And I mean, when you sleep, you feel that you are sleeping very well and you're waking up relaxed. So sleep is very important. If you are struggling with sleep, talk to your doctor or practice some sleep hygiene. That is having some set time to go to sleep, preparing your room, preparing your mind, calming down, so that you can be able to, when you get to that time where you get to sleep, you can go to sleep without any issues. Relaxation techniques is very good. This is where you practice by relaxing your body. Sometimes you can do relaxation techniques from your head to toe. Guided relaxation techniques are very good. So there are so many of that on YouTube, whereby you can really follow someone guiding you into relaxing. That really helps a lot. And it really keeps your mind, it keeps your body in that state where it is not stressed. There are no stresses to make the body be in that fatigue mode. Remember, with cancer and cancer treatment, people are usually very fatigued. So relaxation will do for even alleviating fatigue, as well as making your body to be in that place where it is in a good place to receive treatment and to heal quickly. Meditation is another one, and mindfulness. That is, meditation and mindfulness is also good with like praying, where you set time to pray and to meditate. And meditation is really being present, is really bringing your mind here and really being aware of yourself, being mindful of what you're feeling, what you're thinking, and managing that. It's really nothing big on that. And it requires also practice. It's about bringing your mind here and now. It's always making sure you bring your thoughts to the present moment, that you're aware how your body is feeling or how your body is responding to anything and what is happening within you. It's also good to be aware of what is happening around you. So it's really kind of that complete awareness that is very, very useful, so that you can be able to help your body heal quickly. Meditation and mindfulness is also very good for other people who suffer from anxiety and stress. And even if you don't suffer from those things, meditation and mindfulness are very good skills. They really are very helpful to calm our mind. Guided imagery is another one, where you can also use some tips on YouTube on guided imagery. This is where you just imagine, or you do some imagery and you follow the guided process, because this helps you to keep your mind off the present issues, and it takes your mind off. It's like a distraction technique, where you get your mind away from the worry, from the stress, and you focus it on something else. Laughter and humor, we all know it's good to laugh, and laughter and humor, obviously, they are healing. They are very healing. So if you are undergoing cancer and cancer process, it's always good to listen to comedy, get people who can make you laugh and who are really kind of treating you normally. Because sometimes when we are unwell, people, even who come to see us, they want to be sad, and they want to show sadness, and they bring sadness maybe to you, and you're already sad, and you need people who are bringing humor. You need people who are talking about different things. They don't have to just talk about what is happening. It's just to talk about anything and everything that will keep your mind off stuff and even make you laugh. So humor and listening to comedy and stuff like that is very, very important. Deep breathing is also very helpful. That is being aware of the breathing and having, there are so many deep breathing techniques that you can get on YouTube, whereby you really do nothing but focus on your breathing. Like deep breathing, you inhale in and out and focus on the breath. They say breath is life. So when we focus on our breath consciously, it really, really helps to calm the mind and calms the body as well. Self-compassion is another one. Please love yourself. Help your friends and family to also love yourself. This is the time, if there's any other time you need to love yourself, this is the time to really love and have compassion to yourself. Don't beat yourself over anything. Don't blame yourself over anything. Just self-love and feed yourself with self-compassion. It also helps a lot in assisting your body into healing. The other one is no-brainer, ask for help. Support systems are very good because if they can really help, if people can help you with the practical stuff, then you can be able to manage looking after yourself, your inner wellness, your inner emotions, and what you need to do and to plan. So when you have people around you helping you with the practical stuff, also talking to you, putting your mind off stuff, it is really, really so helpful. So that support system is very good. And of course, exercises, but this depends on where you are in your treatment, your capabilities. You have to be mindful of your body as well, how much exercise it can take, which kind of exercises. So you need help. Sometimes you need help, like from the occupational health. It's good to ask what you can and what you cannot do. So all those things, if you do them one by one, they will really, really help you to be able to manage those stress and alleviate that stress, and also avoid you getting into anxiety. Because remember, as I said, too much stress causes anxiety. A lot of anxiety also messes up our body. And when you have all those chemicals going through your body because of stress and anxiety, it really makes it so difficult for any healing to take place. In fact, most doctors will tell you that they want to treat people with positive attitude. And positive attitude is you are not stressed or so much worried and have anxious about your condition. You have come to that place of acceptance, and all you want to do is to do the best you can to get better, but also you are not stressing your mind in wishing, in having, those, I wish this, worried about things that you cannot be able to change, worried about things that you cannot be able to control, worrying about the whole world, worrying about your family. So when you, or even having that negative attitude in terms of, I don't think I'll go through this, I don't think I'll survive this, having those negative thoughts and having the worst scenarios in your mind, all those things will work against you getting better. So the best thing is to have that kind of attitude, that positive attitude, or we call it optimism. In terms of when we are going treatment, it helps a lot. And the same goes to the family and friends. When you're supporting someone who is undergoing this kind of treatment, it is also very good to have those cues within you, to practice those cues so that you can be able to give the best support to your loved one. So I think I have really listed the most of the things that are quite important in this journey, and especially in terms of alleviating that stress and anxiety during treatment. And I'm going to stop there and ask if anyone has any question, and then we can know where to go next. So I'll stop sharing for now.
Thank you so much, Veronica.
Thank you.
Thank you. Thank you. That was a well-delivered awareness. And I would imagine many who are going through that, and many who have got families going through that, they have something to take with them and follow through. But you've really delivered that well in making us understand how you take action when you're suffering from cancer, or your family suffering from cancer. And as I say, I wish I knew about this program when my friends were going through that, because I suffered just as much as they suffered. I mean, they suffered more, but I suffered more emotionally. So yeah, thank you so much. Yeah, and also I think the last bit there, you're talking about how you can cope with cancer. You know, a lot of the time we have that inclination of just saying, you know, just rest, you know, sleep, you know. But actually what you should be telling them is, come on, let's go for a walk.
Yeah.
And push them to go for that walk. And because you're expecting somebody who is ill to just sleep. But if they're able to walk, cook, move around in their home, there's no reason why you can't encourage them to go for a walk. So yeah, it's just those kind of you know, the different ways of dealing with the emotions and the anxiety, and how to cope with it, and the different mechanisms that you can use.
Yeah. Yeah.
So I find this really, really useful, because, you know, you're telling us about this now, but can you imagine, you know, 5 years down the line, I'll be looking at your video and I'll be remembering, oh my gosh, now I can help my friend.
Yeah.
Now I can, God forbid, but you know, I don't want anyone else to have cancer, or even myself. But at least now I'm more knowledgeable about how to deal with the emotions, how to deal with the, you know, with the worry, how to deal with the anxiety and stress around it. So thank you so much.
Thank you. Thank you. It's good to hear that it's, you know, these things are useful, because, and as I said, sometimes when you don't know things, when you know them, then you are wiser and you can do better.
Exactly.
Yeah. Yeah. Jen, is your hand up?
No, my hand is not up. It was more of saying that was a good presentation. I loved every bit of it. Yeah, as Wamboy was saying, it's always nice to know these things, because not everyone has the opportunity to go into books or do their own research. So this is really good. Thank you.
Thank you. Thank you. You're welcome.
I think for me, the emotional bit is because I think sometimes most of the people, when they encounter somebody with cancer for the very first time, it's their first time to see somebody with cancer. So, and people don't know how to deal with it, how to feel. And I think for me, when you talk about the emotion or the depression, the anxiety, it's like you're going through an illness that's quite anxiety triggering. Yeah. You can't sleep because you're sick. You can't sleep because you're worried. It's like a vicious cycle. And emotionally, everybody have got their own, they're dealing with their own things, stress. And I think that it's quite, and now I know that I'm learning a lot, that even about the emotion, even for example, like you know, like I know somebody with cancer. I think the last time I saw them, they were quite, you know, they seemed quite with it. But, you know, like angry. But now I know they were not just difficult. They were not difficulty. They're going through life, you know, they're going through cancer, they've got depression, they've got anxiety. So for me, I thought about my girl, how, you know, you see how she talked to me. I only thought about myself without me thinking, wow, this person is going through a very challenging illness. But that's, I would not have known.
Yeah.
Until I'm on this, I was on this, yeah.
Thank you. In fact, emotional well-being, people ignore it and people don't want to talk about it. People are afraid of actually even saying what they're thinking. But I think it's very, very healthy to say what you are actually thinking and expressing your fears, because people don't, even the family and friends, they have their fears. They're fearing, they're thinking the worst, and they are going to, and they're feeling sorry maybe for their family member. I mean, I deal with children who their parents are unwell. And of course, when they come, when they refer to us, the first thing is they tell you what they are worried about and what they're scared of, and they're not saying these things at home. But then they go to school, they can't cope, they can't do this. And then they are referred and then say, oh, they have, their dad is undergoing cancer. And then, I mean, or rather when you're doing the assessment, they tell you my dad has cancer and I can't stop thinking what's going to become of him. So, and that tells you that the family members go through their own journey, their own struggle. Sometimes I don't want to use the word feeling sorry, but they are feeling for this, for the person who is unwell. They are thinking about so many things. What's going to happen? Are they going to survive? Are they going to live? How will I cope when my mom died? Or all these things. And they're very stressed and they have anxiety. They can't even concentrate in school. They can't do anything. And it is really going through the whole process with them and showing them how to face the reality that is happening, but also having those coping skills. Then you can help them to be able to manage the journey as they are helping their loved ones. And also remember, because sometimes the family experience more emotional struggles than the patient. Because remember, the patient sometimes they're so weak from chemotherapy and radiotherapy. All they want sometimes is to sleep. They're not even thinking. But can you imagine what the family is going through when they see their family member very weak, loss of hair, all these things? They are thinking the worst. And sometimes they are finding life difficult as it is. They are unable to even be productive at work, whether it's a school or at work, whatever they do, because all they're thinking about is their loved one who is either in hospital or who is at home, and they're thinking a lot of thoughts. And when they have that good space where they can talk about what they're thinking, express their fears, express their emotions, then you can be able to guide them in terms of telling them these emotions are real, you're human, validate those emotions, but lead it as, congratulate them for talking about it, and then guiding them in this kind of skills that they can use. So to alleviate that stress, to alleviate those fears, so that they can be able to cope and be the best support for their loved one. And to be honest with you, I always wish that I had somebody to guide me or to take me or to help me through that journey. I had to do it on my own. It was difficult. It was I don't know what to say. I really don't. I always tell people, I always felt like I wanted to fly away, get away from it all, disappear, but of course, the reality is I couldn't disappear. I had to look after my son. And I can imagine what the families of the loved ones go through. Sometimes they feel the same. And the uncertainty of the whole thing makes you crazy, it's like you're waiting for that call. And you can talk to so many people with cancer patients, especially when they're in hospital. It's like they're waiting for that call all the time. They are waiting for that day. They don't know it consciously. It's like, but they have that thing at the back of their mind. So it's like they even develop this thing of, if they hear a call, it's like, because they're very keen, because they want to know whether that call is from hospital and what is it saying. So and that you can see that anxiety, because as I said, anxiety is the result of stress. So these people are always like on the edge, because they have a sick person and they don't know what's going to happen. And the uncertainty that really lies, is on top of everything, keeps them on the edge. So, and that is when they really need somebody to reassure them, talk to them through the journey and what they could do to manage those emotions. And as I said, awareness of those emotions is very, very, very important. Because remember, most people are not aware of their emotions. They know they are unhappy, but that's all they can tell you. But they wouldn't tell you what exactly they're feeling and why. They wouldn't tell you where that emotion is coming from. They wouldn't know. It's when you take somebody through that journey, how are you feeling? Can you name that emotion? Where are you feeling it? Okay, let's go back and find out, where did this emotion come from? Did something happen, or what are you thinking about? Mostly it will be from what they're thinking about. So if it is fear, then you're going to explore. Tell me what you're fearful of. What are you afraid of? And then they'll tell you, I'm afraid of my mom dying. I'm afraid of that she might never be able to walk again. I'm afraid of, and then you talk about, okay, we are not there yet. But right now, in this present moment, what can you do? What's the best thing that you can do to make sure that you are able to give them the support that they need? How can you focus your mind on focusing on what you could do rather than worrying about what could happen? We are not there yet, but let's talk about the present moment. Let's see what you could do. Let's see how you can help. Let's see how you can manage these emotions. So when you take them through that journey, then things becomes bearable. So that's the knowledge that I think people need to have, and I think it's very, very helpful when you have somebody supporting you through that journey and guiding you and telling you what you could do and how to manage those emotions.